Hello and welcome to Meera's Menopause podcast. As always, we have amazing guests, and today we have an equally amazing guest to every other guest that we've had on, and we've also met before on a previous podcast. So it's always wonderful to meet up again, and thank you for taking the time to be here today as well, Zoe. So Zoe, please do introduce yourself to our listeners. And then we can get stuck into the topic of conversation that I'm desperately eager to talk about. So Zoe, over to you.
Thank you, Meera. Thanks for having me. My name is Zoe Schaedel. My background is as a GP. I'm also a British Menopause Society menopause specialist. And I work mainly in women's health. So I run an NHS menopause clinic. I work in a women's health hub. I also run a private menopause clinic called Myla Health. And do lots of kind of teaching about menopause and speaking about menopause and other women's health topics. I'm also on the Medical Council of the British Menopause Society, and I've got lots of special interests. One of my interests is sleep and menopause. So that's me.
Wow, I mean, you're busy. You are busy, which is amazing. And I am so grateful and thankful to people like yourself who have been working so tirelessly hard to keep the conversation and the awareness and the research and everything about menopause up and in the forefront, because it's quite easy, isn't it, to kind of not realize that there are some of us that have been doing this for a very long time. It sounds like you've been doing it for far longer than I have, but we've been doing it for a very long time, and there's a lot of glamour and noise about it at the minute. A lot of celebrity going on about it, which is great for raising the profile, but quite often I think we lose. I feel like, from what I'm hearing from a lot of women that I speak to, sort of grassroots, and I don't know if you're finding the same thing. There's still a lot of misinformation, but almost it's swung the other way, and there's just a lot of noise which is causing a lot of confusion. I mean, I don't know whether you're finding that in your clinics and in practice.
Yeah, I totally agree. I think that having menopause being so much in the spotlight and having so much information out there is generally brilliant. It's really helped women understand what's going on with them and accessing care and all sorts of different options. But it also has led to some confusion. So women will often come confused, and there's different pressures. Perhaps if we were talking 10 years ago, we would be talking about how people felt embarrassed for wanting treatment for their menopause and asking perhaps for hormone therapy. And now we see women who are worried if they aren't on hormone
Yes.
therapy, or and so it's definitely
Yes.
changed, and the pressures on women have changed. I think one of the things that makes it difficult is the easiest and the best answer to all of this would be speak to your own doctor, your own clinician, and have a conversation about what's right for you. And you should, all the noise out there, that should help you. But one of the problems we've got with that is, over the decades, people have lost a bit of trust sometimes in their own clinicians. They don't always feel confident that the person they see will know or will be educated or will give them all the options. And I think when you have that lack of trust in the medical community, it creates lots of different opportunities for confusion. And so I think it would be so brilliant if you could just say, well, don't worry about what's out there, just speak to your own doctor or nurse or whatever. But that is harder, and people do feel worried about that, and the
Yeah.
trust isn't quite there.
No, gosh, you're 100%, absolutely 100%. And for me, that was definitely the case. And we are talking, 15 or 17 or so years ago. I began to lose trust because there was nobody joining the dots for me. But then equally, I now understand that there isn't that education, there isn't that knowledge. And actually, it's also for me to go in with some education and some knowledge to say, look, here's my symptom checker. I've been logging this for a while. I can see there are changes happening, but they're not isolated. They're all coming together, which makes me think, with my age and everything else that's happening, and my ethnicity, this is what I think is going on. Now, my goodness, that's taken me 17 years to come to a point where I can put all of those things together, because we didn't know that ethnicity had an influence. We didn't understand that lifestyle and trauma and stress could play triggers on this, and we didn't understand what hormone replacement therapy did or was, or how helpful it could be. And I don't think we really even understood the foundational stuff of things like, the basics: looking after yourself, getting moving, keeping your body fat percentage within a good range, a healthy range. So yeah, we've come so far that the questions and the things that people are wanting from us are so different. Yet we seem to still be stuck in a place where it's always seems to be through fear. You're scared, like exactly what you said. I get people saying to me, but I have to take HRT because otherwise I'm going to get dementia, or otherwise I'm going to have a shorter lifespan, or I'm going to get osteoporosis. And I do feel that there is a certain level of responsibility, whilst I completely understand that the medical professionals are trying to get their message out there to say HRT is okay, take it, please do take it if you need to. There's still that thing where it almost comes across as if you don't, there is something going to happen. I'm so glad you raised that, because you yourself are within, you're hugely qualified to be able to be talking about this. I suppose my question, and I think this was the main thing about the topic that I really wanted to speak to you about, because you are so knowledgeable in this and have been doing it for so long. I'm going to get to the menopause and sleep bit in a minute as well, by the way, because that's super fascinating. Having not slept last night at all. But just the main bit that I really wanted to talk to, it's a bit sort of gritty, but I really want to talk about is choice. Because I have been this person that since the day I decided to go on this journey of saying, do you know what, I am going to raise awareness in my own way, I'm going to help women in my own way. But the one thing I want to advocate for is that women are able to make informed choices about what options are available. So that was kind of all okay in a way, because we were kind of talking about this, or maybe there was this, or maybe there was that. But like you just said, now it's changed. So can we almost not take a step back, or maybe just take a little bit more of an overview? When we talk about choices in menopause, what are we actually talking about?
There's so many choices, aren't there? There are choices, even right from the beginning, there's choices about where you're going to get your information from. Who do you want to talk to about your symptoms or your experience? Are you someone that wants to speak to your friends and your community and you can access information in that way? Or do you look more to social media? Or do you have a good trusting relationship with a clinician that you can speak to? So there's choices about, where you want to get your information from. And I think also women make a lot of choices quite early in their kind of menopause journey about, is this something I want to take a medical approach to quite early, or is it something that I want to try other things first? And actually, that it really varies, doesn't it? It's part of your personality. Some people will say, I would much rather not take a medicine for anything, and I would rather try to do exercise or do things naturally. Or some people will look for supplements, go and see what they can get over the counter, that type of thing. And some people will feel like, no, I really need medical help with this as quickly as possible, and for lots of different reasons. So I think that really will depend on what sort of person you are and what sort of experience you have, and also what sort of access and choice you've got around your lifestyle. So some people can say, well, I'm going to book a personal trainer and I'm going to, feel super fit and it will feel easy. And some people just don't have those options in life. They are working really hard, or they've got caring commitments. So our choices are really impacted on by our social situation, and also I think our communities really influence things. So what women say when they come in is very often, this is something my girlfriends have talked about, or this is what I'm hearing from my community. Whereas some people will have a sense of shame or embarrassment that they can't talk to people in their community, that they're worried about that. So there's all sorts of things that will impact. And then you've got the choices about what actually you want to do to manage your symptoms.
Yeah.
So, it's not necessarily about treating it. Sometimes it's living with something, coping with something. And traditionally, we have seen women perhaps try too hard or too long to cope with things without seeking help. And I think that's very much the situation, like we were saying 10 years ago. People would feel as though, because of the bad reputation of HRT, that they had to try absolutely everything that they could before they would take that step to ask for a medical intervention. And I hope that certainly in some kind of groups of women, that really isn't the case now. People feel comfortable to ask for help a bit earlier. Not for
Yeah.
everyone, though.
Yeah.
But when you're thinking about treating your symptoms, there are so many choices within that. Do you want to have hormone therapy? Do you want to have non-hormonal therapy? What types of hormone therapy would you like? There's so many different formulations and ways of taking hormone therapy. And
Yeah.
I think the key is to be really individualized about the decision, and choice is very important for me. So, almost every consultation I have, I want to lay out options for somebody and the pros and cons of each option, and really put it back to them to think about what
Yeah.
might they like to do. There isn't one approach that suits everybody.
No. And do you know what that is? Gosh, I don't know how many times I say that in a day and in a week, because working with individuals and clients that I work with, obviously I'm kind of doing the personal training and the holistic kind of literally overview of their food, their lifestyle. We kind of really delve into what's going on, what is triggering what, how can it be managed. And there just isn't, I first thought, right, do you know what, I'm going to do this thing where I've got, it's a standard formula. It's got to be a standard formula. Actually, it's just so far from being a standard formula, because people's personalities and emotional attachment to certain things, like you said, their backgrounds, their lifestyle, their every single thing impacts their emotional experiences around food, or all of that has a massive impact on how they are as a person, but also how they then are able to make changes. And I think the thing that I find the hardest, and I'd like to go back to kind of choices about, what's changed in HRT in a minute, but I think the thing that is the hardest is that you as an individual, mentally and physically, physiologically, you are changing as a woman. Your relationships are changing, your life around everything is changing. And then on top of that, you've got to then make these choices which will impact that change. Because no matter what you do, whether it's the HRT or whether it's the food and lifestyle, and ideally for me, it should be options. The lifestyle is a fundamental foundation, and your HRT is something almost like a supplement you take on top to support yourself. But they work together, and one doesn't work without the other. But both, exactly as you said, are very bespoke. The thing that strikes me, exactly what you said, I worry about a lot of things, but my worry is that there are people who can afford to come and see me, and there are people who can afford to come and see you, and we're giving those choices to them because they can afford it, because there has to be an exchange of energy, an exchange of money. I do believe that, for the world to go round. But those that don't have, and I'm hoping that a lot of our listeners will take lots of information from today, because I get asked these questions again and again, and I really hope that this episode, because it's already so informative, will be useful. What do we need to know when making choices about HRT? You mentioned very rightly, and I say this all the time, why are you struggling? Please do not struggle. And I have many clients who are like, I'm looking at them thinking, I remember going through this. I wouldn't have done this, because they're like, are you on HRT? I'm not on HRT. I didn't take it. I don't need it right now. I'm taking local estrogen, vaginal estrogen, but I'm not. I would have, if I was living now, going through what I was back then, I would not have struggled in the way that I struggled, because that was awful. But again, what has changed? What should people know about HRT now that might help them to make those better choices for themselves?
Yeah, I think one of the things to know is that HRT, so we call it in the UK hormone replacement therapy, HRT, although in America and worldwide they often just say hormone therapy or menopause
Yes.
hormone therapy. But
Yeah.
when we're talking about HRT, it's not just one thing. So it's not that someone will come along, ask for HRT, and they get a certain prescription. It's actually got a huge amount of options within it and individualization that you have to make. And one of the things to know about is that certain types of HRT have got different risks and benefits to others. So when someone's thinking, if they are struggling, some of the preconceptions they might have about HRT might not be entirely correct about all the options. So just going on, the biggest kind of fear that I think still women have a lot is about the breast cancer risk. So certainly we have got studies that show that certain types of HRT combined together, an estrogen and a progestogen, can increase the risk of developing breast cancer. So if you take it over time. But actually, if that is a fear, it's something you can talk through, because some of the perhaps newer options for HRT seem to be safer. So and also, it depends if you need to have a progesterone as part of this combination. So, if you're someone that doesn't have a uterus, and just need to have an estrogen without a progestogen, that's actually thought that it has little or no risk at all of breast cancer. So, it's really worth just understanding what are the potential risks. So, when we use a natural body identical or a body similar progestogen, actually the risks of breast cancer are thought to be much lower, and actually for many women, there's no risk at all for the first 5 years of use, and then the risk sort of kicks in after that, but it's still very
Okay.
small. And I suppose what
Yeah.
I would want someone to know about that is you always have to weigh up the potential benefits of something against the risks, and that's what the conversation should be about. So we shouldn't be just saying, well, there's a small increased risk of breast cancer with this type of formulation. We should be saying, okay, but what could it do for you now? What could it do for how you feel? Perhaps stop you struggling. And it also can have other benefits to your health. So I think we're more aware of that nowadays, but still it's so important to lay it out and say, well, look, it could also help to maintain your bone density or maintain your heart health if you're taking it within 10 years of your menopause. So it's really about talking to that individual. I have to say, it doesn't mean that that combination is best for every woman. And I think this is another misconception, Meera, that people will sometimes come in with a really fixed idea because perhaps they've heard that natural body identical hormones are the lowest risk, and they really feel that that's got to be right for them. And just as you were saying about individuals being so different in terms of their attitudes to their lifestyle and their experiences, how hormones affect an individual is hugely varied. And actually, it's why I actually love my job, because no two people will
No.
react the same and it doesn't affect them the
Yeah.
same. And literally, our cells in our body respond differently. And so,
Yes.
there will be some women for whom that combination, which they might have heard about as being the one to aspire to, actually isn't right for them. Perhaps they get lots of bleeding on it. That's a really common side effect with that
Yes.
particular combination. Perhaps it gives them side effects like bloating or mood changes. And the nice thing for me is that we've got loads of other options. So this is where
Right.
options come into it. So it's
Yes.
about saying, okay, we can try whatever somebody wants as long as it's safe and appropriate for them.
Yes. Yes.
We can try that. But it's almost about seeing every decision about hormones as a bit of a trial, and you see what it's
Yeah.
like. And if it suits you, brilliant. You do not need us anymore. You can crack on. But if it doesn't, we then go back to the drawing board and we say, well, what about this option, this hormone? What about this combination? Could we take it in a different way? Would something like the Mirena coil be appropriate?
Yeah.
And actually having almost like a buffet table out there of different options available, which
Yeah.
when you work in a sort of specialist menopause clinic, that's the job. That is
Yeah,
what we're doing every day,
yeah,
because one size doesn't fit all. And I really want women to know that there's nothing wrong with you if a certain option doesn't suit you. It's just that we need to look again and we need to find
yeah,
something more suitable.
yeah. Wow, that is, gosh, I love that. It's kind of blown me away because it is, I just love the fact that from the medical perspective, are seeing so clearly and openly what I'm seeing from an everyday living life perspective, which is that women, they are different. Whether I get somebody, it doesn't matter. They'll walk in through the door. They may be the same age and they may be the same ethnicity, they may be the whatever, but how they respond to exercise, what exercises they need, which is why I'm always so reluctant about people going, well, I've joined a 8-week challenge, or I've done this, I've done that, and I'm like, so actually most of the time it's rubbish for you. Or people saying to me, I do 22,000 steps a day. And I'm like, I just say, why? Why are you doing 22,000? You don't need to, unless it's your job, that's fine. But actually, you could use your time a bit more effectively. Let's have a look at what could work better for you. And I think, yeah, it is that individualized approach. And I think explaining it as you have done, I'm hoping that, and again, maybe you'd be able to explain this, if a woman had to go, they can't come to you, they may not be able to see me, whatever it may be, but they have to go and see their GP. And we know that there is still a bit of a lottery whether you get somebody who's open and receptive. And I was actually talking to a GP who is running a practice, still running a practice, and he's really high up in the medical world. And he sat very openly. We're just sitting at a dinner table by chance, sitting next to each other. What do you do? He said, and I'm like, oh, okay, where do I start? Because I do a lot of things, but let's just, you're a medic, so let me just go straight into it and go, well, actually, let's talk about menopause. But he just said very openly in all the years, and he is really high up, really experienced, been doing this for years. He said, to tell you the truth, when a woman comes in and I know her appointment is, a woman comes in with certain issues, certain concerns that she'll present. He said, I don't often have the time to be able to say, these are let's sit down and go through what your options are, number one. Number two, he said, I'm still not educated enough on all the options that are available. So, yeah, I mean, it was lovely of him to be honest, but it just kind of made me think, right, well, what should a woman be doing? What should me 20 years ago, 15, 17 years ago, or a woman now, really, more importantly, what should we be going to our doctors or our GPs? What should we be saying? What should we be asking for? How should we use that 10 or 15-minute window most effectively?
Yeah, and I think we have to be really clear about the reality of what's going on in the NHS and what the real experience can be and what the limitations of it are. And I think one of the things, I actually just spoke to somebody this morning who was saying they'd had an absolutely lovely GP, they'd had a good consultation, and the GP had been giving them options of HRT and was really, really supportive, but had said to them, do you want a patch or a gel? And she'd said, well, I don't know what's the difference. And she could tell the GP was sort of coming to the end of her time and wanting to move her on. And then the
Yes.
person said, well, what about the spray? A friend said about the spray, and the GP said, well, do you want the spray? And she said, well, I don't know.
No.
I don't understand the differences yet. And I totally could imagine from the GP's point of view, perhaps they'd talked about the individual symptoms and the risks and benefits, and it was probably coming to the end of the time. And there just
Absolutely.
is a real limit to
Yes.
what you can talk through within
Yeah.
one consultation. And I think
Yeah.
even with the best trained, best will in the world, it is very difficult to do everything.
Yeah.
But that woman had gone away feeling really uncertain about her choice because she'd gone away with a spray and she didn't really know if the dose was right for her or if this was the right thing. It was just because she'd mentioned a friend had had it. So it felt as though, is this right? And I think this is the real problem with the current system about the very short appointment times, because in all honesty, menopause needs more. You need
Of
to
course.
understand yourself, you need to understand the risks, you need to understand the options. Otherwise, it's very hard to kind of get through this time, which is already very confusing. And, so you really do need that. So there is the limitation of time, which I think is one of the most important limitations. And then there's the limitation of education, exactly as you've said.
Mm.
And I think this has got hugely better. So we do loads of education to GPs, nurses, pharmacists, and in general, the appetite for learning is huge. There are some brilliant doctors out there taking on so much knowledge. However, as you've experienced, and as I experience every day, that isn't everybody. So
Mm.
you cannot guarantee that experience. There are a couple of things that you can do to help, I think. So one of them is to to try and access information before. It's very, I know it's hard to make that entirely relevant to you, but if you have a sense of what you want and what the options might be, that can really help to kind of move the consultation on. It's not always possible. So that's one thing. The second thing is to try and get a consultation with somebody that you think is experienced. And are there any clues? So on the surgery website, is there a GP that says they're interested in women's health? It's
Mm.
hard even to speak to somebody, a receptionist, but if you do get a chance to ask a receptionist, say, is there somebody that's, interested in menopause that I can, so you kind of giving yourself the best chance to
Best
get
chance,
somebody
yeah, yeah.
diagnosed. Yeah,
Yeah.
absolutely. So I think that helps. I think for some people as well, using the options that we have nowadays around e-consultations. So sometimes you've got the
Yes.
option to fill out a form, and I think actually that can give you time to really put down everything you want, and so sometimes that's really helpful. It's a good way to start, because then the doctor has got that in advance and can kind of come back and answer your specific queries or be a bit more understanding
Mm.
about you before the start of the consultation. So I think
Yeah.
that's also good. The other thing is, I think, don't feel put off if they want to sort of spread it out a bit and to say, actually, I think we need to come back to this. I'm going to send you some information. Let's book another consultation. And I think sometimes it can feel really, your heart sinks, oh no, I've got to do all this again. But actually, giving a bit more time to it does give a
Mm.
bit more opportunity. And
Yeah, yeah, yeah.
sometimes GPs might want to do a few tests to make sure that there's not something else going on, like
Yeah.
there can be so many other things, your blood count, your thyroid function, and don't necessarily feel like that's a barrier or a door shut in your face. It actually gives a bit more opportunity with time. And sometimes I think that's the best way of doing it, is to spread it out a little bit. So
Yeah.
all of those things can be helpful.
Hugely helpful. No, that was amazing. A really, really useful, lots of useful information in that to take away. And also, you balance that out with understanding what's sort of going on for the GP, for the medical practitioners, because I think that's also slightly misunderstood sometimes. I think that, oh my gosh, you've kind of answered everything. It's been absolutely brilliant. It really, really, really has. I suppose my next question, and we're kind of drawing to the end of the episode, which is such a shame because there's so much more we could talk about. But where would where would you recommend that somebody would go to get the information that they need, which is non-biased, it's factual, obviously your website, I'm assuming as well, where you are. So yeah, I mean, where would you recommend people? Because not everybody's on
Yeah.
Instagram. Some people are better on websites. Some people prefer books, or I don't know. But anything that you can
Yeah,
think of.
absolutely. Like great, obviously, great podcast like yours, Meera. That's a good place to start. But
Thank
certainly,
you.
in terms of a website, I would always say the Women's Health Concern website. What you find on there is really evidence-based information that doesn't have a particular angle. So you've got very straight information based on the guidelines. It's going to be in line with what your doctor is referencing as well. So it kind of connects to the British Menopause Society's guidelines. So it's a really safe and trustworthy place. The Women's Health Concern has got some good information sheets on there. There are also, if you are on Instagram, Anise Mukherjee is fantastic to follow. So she puts very, very good information out there. And she also has a book. I can't quite think of the name of it, but it's a really brilliant, overall description. I think again, it just depends where you like to get your information from. But in terms of websites, I think that would probably be Women's Health Concern, would be a really good start.
Yeah, fantastic. Oh gosh, so much information there to digest, but yeah, you've honestly just like literally answered everything, and it's been, gosh, it's been such a pleasure. It always is, actually. I remember I was speaking to Ari before, before we came on and to record this, and I just said, gosh, I remember when we spoke last time very clearly. I gained so much knowledge from what you what you said. I think finally though, before we go, I keep saying finally, but there is one more thing. There is the menopause and sleep thing. I think we need to have another podcast for that though. It just sounds like a whole topic. I mean, you said your interest was in that though. You've got a specialist interest in that. Is there research going on about this, or is this just your own kind of
That's a good
observational thing?
question. Yeah, so actually there is some research, not enough, but there is, and it's interesting because I've had an interest in sleep medicine for a really long time as a GP, and in general practice you see people with sleep problems a lot, and
Oh yeah.
then I became a menopause specialist, and then I started working in a specialist menopause clinic. And if you think you see sleep problems a lot in general practice, it's got nothing on a menopause clinic. And so I suddenly thought, well, hold on, what do we know about what to do with these women? And actually, the evidence is pretty poor. Is HRT a cure? That's a question. Can you use sleeping pills? What do you do? And so actually, I've spent, a long time really working in this field and trying to work out some of the answers. And in all honesty, we do need another podcast because it's not just one thing.
Right,
It
let's do
goes
it. Let's do it.
tangent
Let's book in
from
another one because we've
yeah.
got to talk
So,
about this is the
I
biggest
think that
topic.
yeah, absolutely. And the problem is it obviously impacts on so many things. It makes
Oh,
if your sleep is going wrong, it makes other menopause symptoms more difficult and it makes life more difficult. So, but I think I always take the approach of get the menopause sorted, get your hot flushes treated, however you want to do that, in whatever way. Get those things sorted first. Make sure your
mm,
mood is not being too affected by menopause. And then you shift focus and you focus on the sleep. So you've got to tick the menopause
mm.
boxes. It's really hard to sort the sleep out if you're
Yeah,
having night sweats every hour. You've got to sort that. But once you've sorted it, you focus on the sleep and you use what we use in sleep medicine, and you use things like cognitive behavioral strategies, which can be brilliant in menopause. It's got a really good evidence base for it. And there's other techniques. Make sure that the sleep habits are healthy, but there are even
yes.
medications that can be used as well. So it's a whole assortment of approaches, but I really want to treat sleep. That's I really want to treat sleep
Let's
mechanisms.
do it. Let's get a podcast
Yeah.
because there is not, I mean, I would say out of the, I mean, let's just say 25 people that I would treat, I would say about 22 of them have sleep issues with regards to menopause. So it's huge, and it can look the same, and it could look slightly different. It seems to be different, and it also seems to be
Yeah.
different. This is a whole thing for you, but also seems to be different perimenopause, menopause, and postmenopause. Because perimenopause, I mean, it was an absolute shocker.
Yeah.
But post-menopause, I kind of thought, oh, okay, I'm all right. No, now it's slightly different. Now it's a whole different waking up thing. It's not always that 3 o'clock wake up, which used to be the perimenopause. It's now kind of a bit of sleep first, then no sleep at all in the whole chunk of the night, then a bit of sleep before I wake up, and I'm absolutely shocked. I can't function
Yeah.
at all. But
Yeah.
I think we
Yeah.
should definitely have you on again if you don't mind.
Of course, I'd love to. I'd love to.
Oh my God, absolutely amazing. But I do feel, because obviously my concentration span is very small, and hence why we do
Yeah.
30-minute podcasts, because that's
Yeah.
why I just thought, no, anybody says to me, do you want to listen to a podcast? I'm like, well, how long is it? They'll say an hour. Nope, can't do it. Not even in two bursts, because I actually lose interest between the first half and the second. So I've sort of decided that our podcast will be The Menopause podcast will be about 30 to 40 minutes so that people can listen while they're doing whatever they're doing, and it's kind of enough. So I mean, and you have shared so much information I'm so grateful for. So before we kind of close off and finish, I just want to say to my listeners, thank you so much for joining us today. And if you have enjoyed the podcast, I mean, I really, really have. I've learned so much. I'd love you to be able to share this with your friends and family. I'd love you to be able to follow, please, subscribe, and also just get in touch as well. I love hearing from you. So if you've enjoyed the podcast, let me know why, and I can always share it with Zoe. If you'd like us to talk about something else, like the menopause and sleep, let me know, because it's always lovely hearing from you. Zoe, just to finish off, could you give us one tip that if our listeners were to think about starting tomorrow, actually probably more around the choices, because you've given a lot of tips, but if there's just one thing that you could say, right, do this and it can help you, what would that be?
I
Hard
think
one, sorry.
it is looking at it's hard, but I think it is also looking at the basics. You can reach for the things out there. You can reach for, a fancy supplement, or you can reach for a medical treatment. And it's just before you do that, just look at the basics, because they can be really powerful. And actually, if
Yeah,
I had to pick one, and again, I don't know what you pick, but I probably would pick exercise. If I'm
yeah,
speaking to people that aren't moving at all in their day, and for very, very good reasons, and life has just become too much. I think, look, what difference could that make? It? And we layer then, you layer on top of that.
love it.
But I think it
Yeah.
is really important just to look at basics too.
Yeah, yeah. I cannot. The words absolutely out of my mouth, because literally it is the basics, and I found that as soon as we as soon as we pay attention to movement and food and hydration, particularly eating more than you think you need to eat and the right combinations of food, suddenly, and not taking food out, but just right combinations of food for that person, suddenly you find that the mood changes, the exercise starts to get easier, also the sleep gets a little bit better. So you're absolutely right. I love that tip. Thank you so
And the
much.
treatment is more effective.
Yes,
Just everything becomes
completely.
a bit better when you've got that. Yeah.
Absolutely, absolutely. Zoe, where can people find you? How can they get in touch with you? Please let us know.
So we have a website which is mylahealth.co.uk. I'm on Instagram at Zoe Menopause Doctor, and yeah, that's it.
Oh, amazing. Thank you so much for joining me today. It's been an absolute pleasure and totally informative. Thank you.
Thank you. Lovely to be here, Meera.